Welcome to our latest explainer. Today, we're diving into something pretty amazing in the world of knee surgery. We're talking about a way to fix arthritic knees that doesn't involve a full replacement. Instead, what if you could just realign the joint and give it a whole new lease on life? It's a game-changing idea called joint preservation, and it is totally transforming how we think about this problem. So let's start with that big question right there. What if the best way to fix a worn-out knee isn't to replace it, but to give the original joint a really precise tune-up? All right, so here's how we're going to break it all down. First, we'll look at the actual problem with worn-out knees. Then, we'll explore this whole joint-preserving idea. After that, we'll see how it works for bow-legged and knock-kneed people. And finally, we'll get into the super smart surgery that's making all of this a reality. Okay, let's get right to the root of it. Why do our knees wear out in the first place? Well, it turns out it's not just about getting older. It's a little more complicated than that. The condition is called knee osteoarthritis, or KOA for short. And it's not just random wear and tear. It's actually a chronic disease, and it's often caused by a mechanical problem, like a misaligned joint. The best way to think about it is like having a car with bad wheel alignment. You know how one side of the tire wears down way faster? That's exactly what's happening inside your knee. And get this is a wild number. Just because of how our bodies are built, the inner part of your knee takes on a massive 60 to 80% of your body's load with every single step. That huge, uneven pressure is exactly why that part of the knee is so likely to wear out first. So if the main problem is just bad alignment, what's the solution? Especially for people who are younger, more active, and really want to avoid getting a total knee replacement for as long as possible. Well, the answer comes from a totally different way of thinking. Instead of replacing the joint, surgeons are focused on this idea of knee preservation. And the key procedure here? It's called an osteotomy. The idea behind it is actually pretty simple and honestly kind of brilliant. A surgeon makes a very precise cut in the bone and then just realigns it. That small adjustment completely changes the geometry of the leg, and it redirects your body's weight away from the damaged cartilage and onto a healthier part of the joint that can handle the load. Okay, so let's see how this actually works in the real world. We'll start with the most common problem, correcting bow-legged knees. Now this is the big one. This bow-legged alignment, the medical term is varus deformity, is the issue for almost 3/4 of all patients with knee osteoarthritis. It is the classic case of that inner part of the knee just taking way too much of a beating. And this illustration shows the problem perfectly. You can see how that line of force coming down from the body's weight is passing almost entirely through the inside part of the knee. That constant pressure is just grinding down the cartilage over time. So what's the fix? It's a procedure called a high tibial osteotomy, or HTO. A surgeon makes a super precise cut in the upper part of the shin bone, that's the tibia, and then opens up a little wedge-shaped gap. And just look at the result. It's amazing. That simple realignment shifts the entire mechanical axis of the leg. Now, the body's weight is distributed over the healthier cartilage on the outside of the knee. For patients, this can mean huge pain relief and, just as important, it could delay the need for full knee replacement for years, sometimes even decades. Now, surgeons have a couple of main ways to get this done. There's the open wedge method, which we just saw, where they create a gap and hold it open with a special plate. The other way is a closing wedge, where they actually remove a small wedge of bone and then close the gap. Either way, the goal is exactly the same: perfect realignment. Okay, so that covers bow legs, but what if a person's knees are misaligned in the complete opposite direction? Right, so this knock-knee alignment is called a valgus deformity. In this case, all the force is being shifted to the outside of the joint. It's less common, affecting about 16% of patients, and for these folks, the correction is usually made a bit higher up in the thigh bone with a procedure called a distal femur osteotomy. Now, this might sound like a pretty straightforward, almost mechanical procedure, but don't let that fool you. The technology behind it is becoming incredibly advanced and really, really smart. I mean, we are seeing some incredible innovations, things like advanced locking plates that give amazing stability while the bone heals. We have computer-assisted navigation that helps guide the surgeon's cuts with pinpoint accuracy. And then there's this, absorbable mesh gaskets that actually encourage new bone to grow, and then they just dissolve away. That means no need for a second surgery to remove any hardware. How cool is that? So the really crucial takeaway here is that this isn't a one-size-fits-all solution. Think of it like a surgeon's toolbox, filled with different types of osteotomy procedures. You've got the HTO, which is kind of the standard, but it has some risks. Then there's the PFO, which is simpler, but has to be done carefully to avoid nerves. Each procedure has its own set of pros and cons, which lets surgeons create a perfectly tailored approach for every single patient. And this all brings us to a really fascinating thought for the future. So far we've been talking about fixing damage after it's already happened. But as these surgical tools get smarter and even more precise, imagine a future where we could spot a misaligned joint in a young person and correct it before the cartilage even begins to wear down. Could we one day get to a point where we prevent this type of arthritis before it even starts? Now that's something to think about.